So, what do we see with long COVID symptoms and how Chinese medicine can address this seemingly new condition? Right. So we've got this pandemic going on. We've got a lot of people getting COVID, and then some people having these long-term symptoms following their infection. So it might look like things like fatigue, chest discomfort, chest pain. People having like chronic coughs, shortness of breath. They get winded very, very easily. Many people don't even realize that they have lung symptoms until they start walking up the stairs, and they're out of breath very quickly. A lot of people complaining of heart-related issues, even if they're passing tests in their doctor's office. They're having chest pain. They're having heart rate irregularities. Maybe they're having palpitations or just discomfort with their heart. This might change with lying down, with sitting up. Some people are coming into my office saying, they used to exercise a lot after they got COVID. They would try to exercise and their heart rate's jumping up incredibly fast. It makes them very anxious. Oftentimes they complain of problems sleeping. Some people are having blood pressure elevations since then. Of course, digestive issues become a part of this. It becomes this whole big complex, right? Maybe they have problems with their nose, their sense of smell, their sense of taste is either gone or it's altered in some way. And then they complain of this thing called COVID tongue, right? People get these big, thick films on their tongue. It looks very kind of disgusting, caked on there. But I'm seeing a lot of this nowadays in the clinic. People are not quite sure what to do about it. But really, this is a kind of presentation that we've seen often throughout history. People developing these almost like big biofilms on their tongue, and they're ending up with multi-system symptom complaints. It looks like heart, lungs, digestive system, a whole variety of things are going on. And I'm seeing this time and time again with people. And of course, this idea of this phlegm or biofilm on their tongue. So in my clinic, it's something that we've kind of started treating in a very similar way, kind of across the board. And I almost am always starting with an herbal formula that addresses primarily the lungs, but it deals with this retained mucus or phlegm or biofilm that gets stored in the body that happens through this infection. Now, if you know anything about biofilms, you know that a biofilm is basically a mucus covering that pathogens use to adhere themselves to surfaces inside your body to protect themselves from your immune system or to protect themselves from a drug, say like an antibiotic. So you get sick, you get a fever, maybe you take an antibiotic, you've got this inflammatory response, AKA a fever that's going on in your body that's designed to eliminate this threat to you, this pathogen, this thing that's there to harm your body. So your body's fighting. It launches into this inflammatory response and starts killing off whatever's infecting you. In this case, COVID-19. Now, some of these pathogens will say, holy cow, we're about to die. And they'll cover themselves in this biofilm, which basically causes them to hibernate. And they just kind of hang out and they wait for the appropriate time to come back out and proliferate. This could be months down the road. It could be represented as, recurrent sinus infections. I see this kind of thing with recurrent UTIs or UTI-like symptoms. We see biofilm evidence in anything from obesity all the way up to autoimmune disease, such as multiple sclerosis. So one of the first steps that I take is generally in addressing these biofilms. So I use a formula that helps in breaking down biofilms, helps dredge out this phlegm that gets stuck in the lungs. To this, I'm generally adding something that improves circulation, especially in the chest, because a lot of people are complaining of chest discomfort, chest pain, heart-related type symptoms. This combination of addressing these two things very often will help with things like fatigue. It'll help with these heart-related symptoms, this discomfort. Oftentimes it helps with the anxiety and the insomnia that becomes a part of this. And then I just modify based on what the individual's chief issues are. If they've got other issues that are going on, something I'm seeing a lot of is people having long-term sore throat issues, or they'll say that they get these intermittent sore throats, or they're constantly clearing their nose, or they're dealing with chronic postnasal drip. Basically, they're dealing with an issue that with the stomach that's caused either acid reflux or silent reflux, which is sort of aggravating the whole problem. So I'll make a little adjustment for that to start guiding the stomach back down. That stops this reflux. But so we basically end up with a formula that's addressing this underlying issue, promoting circulation, dealing with pathogens. And most people are doing extremely well with it. We see the smell and taste start to resume. We see some of these neurological symptoms going away. And from this standpoint, in some ways, it's kind of basic. And a lot of our patients are doing very, very well with this type of approach. This is kind of the main thing that we've been doing for these long COVID issues. Every now and again, I get somebody that needs a little bit of special attention, needs something a little bit different, but largely it's a lot of the same thing, because this is what the virus is doing to the body. So hopefully that's helpful. If you need further help, you can check below the video here, contact information down there. Thanks. Bye-bye.